On fingers crossed. Oh, we're live. Woohoo, we did it. All right, I'm going to show the video again. Here. Hello, everyone. Welcome to Thursday Live with the Doctors. Hello, Dr. O'Connor.
Hi, Dr. Miller. Welcome, everyone. Thank you for attending.
Yeah, thanks, guys, for coming. This is a fun talk. It's not fun. It's really important and interesting, but we're going to make it fun and lively for everyone. So I'm excited for this talk today. But first of all, hello to everyone. Welcome, welcome. Please, if you feel up to it, say hello and let us know where you're coming from. In the meantime, I want to introduce a few things about this talk. So Dr. O'Connor and Dr. Pierce, another one of our Love.Life Telehealth doctors, put this talk together for the plant-based nutrition support group last month, and it was well received, and I thought it would be really interesting to share this with all of you. So Keary, Dr. O'Connor, was kind enough to talk about fatty liver with us, and she's going to give us the ins and outs today. So we're going to jump into that in just a minute, but we got Debbie from Walla Walla. Hello. And we got Sharon. Hello. Boomer and Beyond Wellness. Hi, guys. And there's Sharon from Ohio. Great. Welcome, everyone. Brissa from Tri-Cities, Washington. Awesome. So a couple announcements. First of all, we have a program that we're launching here with Love.Life Telehealth that we're super excited about. Dr. O'Connor, why don't you tell us about this and why we're so excited about it and what people can do if they're interested?
So it's a 6-week program. It begins Sunday, April 7th, and it ends Sunday, May 12th. It's 6 weeks, 90 minutes each Sunday. And we take each week, we delve into one of the 6 pillars of lifestyle changes in medicine, and we do a really deep dive. Each week, we'll have 2 of our Love.Life Telehealth doctors on, and we'll talk about sleep, stress, relationships, toxins, nutrition, and exercise. And each one will have its own dedicated week. And during that 90 minutes, we'll have some discussion, presentation, maybe some exercises, and then ample time for question and answers. So we're going to put a link. I'll put a link in the chat box right now. And we will have a, and Chris, you might be able to better do this, but she'll have a link across the bottom as well, too.
Yeah, it's called Love Your Life 6 Pillars program, and we're excited. We have many of us doctors with plant-based telehealth are going to be there sharing information about these 6 pillars, because really they are the foundation to health. And so whether we have a chronic illness that we're trying to reverse, whether we're looking for longevity, whether we're just looking to be happier and have more energy in daily life, it comes down to the 6 pillars. And we're going to focus on specific tips to help improve everyone. So check it out, read about it. Let us know if you have any questions. And it's just something we're super excited to get to start. So
yeah, and oftentimes in a visit, we can only focus on 1 or 2 pillars in our visits with our patients. And it can be difficult for us too, because we want to get to all 6 of them, because it's a combination of all 6 working together that really can help move the needle in the direction of health for everyone. So that's why we want to take a deep dive into each specific pillar.
Excellent. Wonderful. Okay. Well, enough about that. Let's get to the heart of this. We're talking about the liver today. So I'm going to upload your slides. Keary was kind enough to share her slides with us so we can get all the information. So there it is.
All right. So we're going to be talking about basically fatty liver. And the new terms are metabolic associated steatotic liver disease and metabolic associated steatohepatitis. You may have heard or read about these as NAFLD, non-alcoholic fatty liver disease, and non-alcoholic steatohepatitis. But these are the new official terms. In this talk, you may hear me say fatty liver or steatohepatitis or steatotic liver disease. We're referring to metabolic associated. So here's some of the things that we'll discuss, just a little bit of intro. Some of in the format, changing it from the PowerPoint up to StreamYard, some of the formatting is off. So please, I apologize for that, but there was no way to correct it. So again, here's what was NAFLD is now MASLD, NASH, now MASH. The guidelines were updated in May of 2023, and the name change was official in June of 2023, but you will still see in studies that are cited today, they were done prior to the name change. So you will still see in literature the old name as well. Steatosis just means fatty liver. And in order to have steatotic liver disease, you need at least 5% or more of the hepatocytes, which are the liver cells, infiltrated with fat. The steatotic liver disease is the most common cause of fatty liver in the US. The steatohepatitis is a subset of that fatty liver disease. For that, a biopsy is required for diagnosis, and we'll get into that. The steatohepatitis can be reversible back to steatotic liver disease. Steatotic liver disease can be reversible back to a normal liver. But if you have hepatitis, which is the metabolic associated steatohepatitis, which is the more advanced stage, if that has advanced to cirrhosis and advanced cirrhosis, that is not reversible. About 30% of the population is affected. In terms of whether or not you need a transplant or considering morbidity and mortality, fibrosis is the single histopathologic feature that is considered. It is the leading cause of transplants in women, steatotic liver disease, and those over age 65. It's projected by 2030, there will be 80,000 deaths from steatotic or fatty liver disease. There's no United States Preventative Services Task Force screening guidelines for this, but it's recommended that anybody over 50 with metabolic syndrome or anyone you suspect who might be at risk. And we'll talk about some of those risk factors. But this is not just an adult disease. As of 2021, it was estimated that 5 to 10% of children and adolescents had fatty liver. And it affects boys typically more than girls, but it is a significant problem in children and adolescents. So here's a schematic of the liver. The reason I show this to you is I wanted to point out one thing, which is the portal vein. And the portal vein you'll see at the very bottom is kind of that purplish vein that goes up into the liver. That's responsible for what's called first pass metabolism. So anything we ingest, whether it's medications, fluids, foods that go through our mouth, our esophagus, to our stomach, into our GI tract, first gets metabolized and passed through the liver. So the liver is one of our 2 detoxification organs in the body, the other being the kidneys, plural. So some functions of the liver, again, detoxification organ, it's for glycogen storage. It can release that glycogen in the form of glucose with help from glucagon from the pancreas, produces bile. About 50% of the bile is stored in the gallbladder, which aids in digestion, produces plasma with the help of vitamin K. It helps break down TPA. TPA is used to break down clots. And again, that first pass metabolism. Again, some functions of the liver. We're not going to go through all of these, but interestingly enough, one of the things is the conversion of T4 to T3 for thyroid health, right? And T4 we know is produced by the thyroid gland. It converts it peripherally to T3, which is the metabolically active form of the hormone. So there's 5 different categories for liver disease, 5 causes. We're going to focus on metabolic. First, there's alcohol. We're not going to focus on that today. But again, there's really no safe level. Any level can potentially cause damage to the liver. Metabolic, we're going to focus on the MASLD and MASH. There are medications, and there are a couple of different categories. There's one, it may be secondary to liver injury or secondary to weight gain with some medications that lead to the steatotic liver disease. There's other groups of medications that actually create more fibrosis than they do fatty liver. Also hepatitis C, genotype 3, and some rare genetic syndromes. But again, for the remainder of the presentation, we'll be focusing on the metabolic causes. Again, here's just a schematic. So it's an eye chart, but just to show you there's numerous medications where they affect the liver. So the steatotic liver disease is a diagnosis of exclusion. Again, there's no screening guidelines. Fatty liver can be seen on ultrasound, and it's often an incidental finding. For the steatohepatitis, you need a biopsy plus one of the following 5 below here, which includes BMI, glucose, blood pressure, triglycerides, and HDL. These 5 criteria mirror very closely the criteria for metabolic syndrome as well, too. There are 2 liver enzymes that are important for us to discuss. One is ALT and the other is AST. ALT in fatty liver disease will typically be higher than the AST. The ALT is specific to the liver. AST is for the liver, and you'll also find it in muscle tissue. So the ALT is a little bit more of the focus. One of the interesting things in normal liver and in severely diseased liver, like advanced cirrhosis, you can have normal liver enzymes, so they can be a little bit deceiving. Once those hepatocytes have died, they no longer produce the AST or ALT, so it can be very deceiving. Screening for fibrosis, patients with obesity with metabolic complications, type 2 diabetes, moderate alcohol use if there's a family history of cirrhosis. There are stages of scarring, 4 being the most severe. There is something that's used now called a FIB score, a FIB-4 score. It was originally created for patients with HIV. However, they found in patients over 35, it worked really well for prediction for morbidity and mortality of fatty liver disease. It uses age, your ALT, AST, and your platelet number. Let's see here. Symptoms of fatty liver. Often there are no symptoms. It's, again, an incidental finding. Early, there could be some abdominal pain and fatigue, but typically the symptoms are not present until late. They can include, abdominal bloating, ascites, itching, palmar erythema, nausea, anorexia, or, decreased appetite, not wanting to take in food orally, weight loss, jaundice, which is a yellowing of the skin, or scleral icterus, which is where the eyes turn yellow, the whites of the eyes turn yellow. You may have bleeding in the esophagus, the stomach, or the rectum. And again, those are more often late stage findings. There's no approved medications for the treatment of fatty liver disease. The foundation is lifestyle changes, dietary intake with a whole food plant-based diet. And I'm just going to throw this question out here. Why do you think, and you can put comments in the comments box, why do you think ketogenic diets are bad for fatty liver disease? And we can come back around to that, but they are definitely not recommended if you have fatty liver disease. Exercise can reduce liver fat, even if there's no weight loss. 5 to 10% weight loss can reverse early fibrosis, but not advanced. And again, we want to, rounding out all of the lifestyle changes, avoid toxins, improve sleep, lower stress, and definitely connect with others in person, real time. It's important to control hypertension, hyperlipidemia, and type 2 diabetes, especially in those with metabolic associated steatohepatitis, the more advanced form. Typically, these patients will die from cardiovascular disease. All of these conditions could lead to cardiovascular disease, but with that added diagnosis of steatohepatitis, it just makes it that much worse. Statins, the one statin that you can use if you have hyperlipidemia and fatty liver is rosuvastatin, because that has less hepatic metabolism than the other statins, so it's better tolerated. If you have strictly fatty liver disease and not hyperlipidemia, statins are not recommended. You also want to avoid medications like metformin, milk thistle, or urosodiol as medications for solo treatment for fatty liver disease. There was one study in 85% of patients who underwent bariatric surgery, they were able to reverse their metabolic associated steatohepatitis. There's some evidence that vitamin E can help, but you definitely want to avoid that if there's a history of diabetes or prostate cancer. There's a couple of other medications. We have a few slides on the GLP-1s, but again, the cornerstone is lifestyle changes. So GLP-1, it's a glucagon-like peptide 1. It's a receptor in the upper gastrointestinal tract and in the brain. And when you take these GLP-1s, the body thinks there's enough glucagon on board, so insulin keeps working unchecked, and it can potentially lead to low blood sugar or hypoglycemia. These GLP-1s can have a positive impact on body weight, lowering body weight about 10 to 15% over 1 year. But it can also have some clinical, biochemical, and histologic markers for improvement of fatty liver and early fibrosis with patients with metabolic associated steatotic liver disease. It changes the appetite in your hypothalamus, can lead to bowel obstruction through inhibiting gastric outflow and gastroparesis. Gastroparesis is often a complication of somebody who has diabetes already, type 2. So adding this medication can compound that problem. When you look at the weight loss, about 20 to 30% of the weight loss over the year is fat-free mass, meaning you're losing lean body mass. Once the medication is stopped, there's rapid weight regain upon cessation. And then there is some consideration that there could be potentially some malnutrition on these medications because it so severely decreases somebody's interest in their hunger in eating. And we're not sure yet, I'm sure there's more data to come on this, if the body actually stops producing the GLP-1 while patients are on the medication. So more to come on that. There is a black box warning for medullary thyroid cancer in those with multiple endocrine neoplasias. Here's some other side effects like GI, gallstones, pancreatitis, mood changes. You can worsen diabetic retinopathy. There is some data that it shows it can be protective of the kidneys. However, I've read in places as well too, because it lowers the fluid volume, it can actually be damaging to the kidneys. There are some behavior changes that are being studied as well too. And interesting to note, the American Society of Anesthesiologists has recommended that anybody undergoing a colonoscopy or an EGD should stop the medication at least 1 week or 1 day, depending upon your preparation before a procedure, because they note that this medication leads to aspiration during the procedure. There's an interesting article I read a while ago showing that there are some tech companies that are looking at if they can identify a better target for GLP-1s, whether the hunger originates in the brain or in the gut. So I think there's going to be a lot more to come on that as well too. So this chart's a little wonky, but this was due to the formatting. I apologize. But this was presented at Physicians Committee for Responsible Medicine meeting this past summer. And it shows that Wegovy is about $1,300 a month. And instead of paying cash out of pocket for Wegovy, you could actually have a dietitian weekly for about $600 a month. Groceries about $500 a month, a gym membership, and then a vacation. So what you would pay out of pocket for Wegovy, these are the things that you could get over the course of a year, theoretically. Again, the foundation are the 6 tenets of lifestyle medicine. These are the things we'll cover in our 6 pillars program in depth, which is dietary intake, exercise, lowering stress, avoiding toxins, sleep, and relationships. Those who ate a whole food plant-based diet, high in vitamin A in the form of carotenoids like legumes, grains, fruits, and vegetables were the least likely to have non-alcoholic fatty liver disease in one study. And another one showed foods like red meat and processed meat because of the risk of the risk of non-diabetic, non-alcoholic fatty liver disease, which we now know is metabolic associated steatotic liver disease. Also, the 2005 to 2010 NHANES study found that adherence to a healthful plant-based diet was protective against fatty liver disease. Again, foundational is whole food plant-based diet. You want to increase your fiber intake. So just something to think about and maybe to apply in your own life. It's like, how much fiber are you currently consuming? And there's various apps out there that you can use to plug things in. But it'd be interesting to know how much you're actually taking in. The countries with the highest fiber consumption have the lowest rates of colon cancer. If you are someone who's not consuming a lot of fiber right now, go slow and slowly increase it over time. And engaging with any one of us physicians, we can definitely, in a visit or even in the 6 pillars program, talk, steps to do that. Types of fiber, this is really important to know. We need both soluble and insoluble fiber. The soluble forms a gel. It slows the transit time in the gut. It traps fat. It will stabilize the blood sugar and lower cholesterol. And here's some forms of soluble and insoluble fibers. And something I learned putting this presentation together is that kiwi was a citrus fruit. I did not know that. And you can eat the peel. So there's a little more fiber for you. Insoluble, these are the pre and probiotics that our microbiome consumes and digests for our health. So prebiotic, these are the fibers not digestible by us, but by our gut bacteria. And here's some examples. And then probiotics, these are the fermented, the beneficial bacteria that you can get from like miso, sauerkraut, tempeh, natto, kimchi, sourdough bread, things of that nature. We want to lower our saturated fat consumption. It's more harmful to the liver than sugar. There was a study that showed they had 3 arms of the study. In addition to the control, they had patients were fed sugar, diets with high in sugar, high in unsaturated fats, or high in saturated fats. And the triglycerides were increased by 55% in the diets that were high in the saturated fat. Sugar increased triglycerides by 33%, but there was minimal by the unsaturated fats. So that getting the saturated fats out of the diet is really important. And again, that going back to the original question about the ketogenic diet, it's so high in fat, it actually can contribute to the development of and worsening of fatty liver disease.
Boomer and Beyond Wellness gave an answer, said saturated fat for keto. So
yay.
They called it. Good job.
And also saturated fats will increase the risk for heart disease and type 2 diabetes. You want to eliminate high and ultra processed foods, including highly processed vegan foods. They are no better for you than the standard American diet, highly processed foods. You want to limit and avoid liquid calories. Those are the free sugars. For example, if you have a drawer full of oranges in your refrigerator, better to eat the oranges than to put them through a juicer and drink the juice. You get all of the, you miss the fiber when you put them through the juicer. If you eat them, you get all of the benefits of the pulp, the fiber, the phytonutrients, everything together. You want to avoid trans fats. Trans fats are really misleading. If a product has less than 1/2 gram of trans fats in it, labeling laws in the United States allow a product to be labeled as 0 grams of trans fats. They are directly linked to heart disease. So labeling in the US is very misleading. So you'll find it in some processed foods, hydrogenated oils, in meat and dairy. You want to increase your omega-3s that can lower your triglycerides. Avoid artificial sweeteners and keep your triglycerides at or below 150. Most of our body's fat is stored as triglycerides, stored in the liver. It's the most common type of lipid or fat in the body. And dietary sources that will increase triglycerides include alcohol, oils, butters, excess caloric intake, sugars, refined carbohydrates. And intrahepatic triglycerides are a marker for fatty liver disease. When they looked at fasting blood sugar, just blood sugars, A1C, and triglyceride level was the one that was most closely associated with fatty liver disease. Here's some other things elevated triglycerides are associated with. There are some non-dietary causes such as liver kidney disease, rheumatoid arthritis and thyroid disease, smoking, lack of physical activity, and certain medications. There's also some other risk factors like family history of being South Asian ancestry, HIV, lipid metabolism disorders, things of that nature. So free and added sugars definitely warrant a mention. Excess sugars, well, first of all, sugar is glucose is the nutrient, the macronutrient carbohydrate that is used by our brain. That's what we need. We need about 500 kilocalories or 500 calories a day for proper brain function. But cognitive impairment, and there's an increased risk of dementia for excess glucose or excess sugar intake. It's also, again, associated with these other conditions, steatotic liver disease, diabetes, obesity, insulin resistance. Added sugars began to increase in the 1980s. This is when it was found that fats were associated with cardiovascular disease, and refined carbohydrates, refined ultra-processed foods began to become on the rise. About 70% of foods, actually, I think it's closer to 80% now in the grocery stores, contain added sugars. So we're all getting more than we think. So just sort of a mental exercise for yourself is, can you think of some foods in the grocery store that may have added sugars that may not be necessary? And there's a challenge that I typically throw out to people. If you're in the grocery store next time and you have a few extra minutes, stand in front of either the ketchup section or the pasta sauce section and see if you can find one without sugar in it. It's really hard to do. The main dietary source of added sugar, though, is still sugar-sweetened beverages. And the Framingham study, which was started in 1948, found that frequent consumers of sugar-sweetened beverages had significantly increased liver fat, dysbiosis, which is dysregulation of the microbiome in our gut, and decreased HDL and increased triglycerides and cholesterol levels, all associated with metabolic syndrome. Sources of free sugars include like fruit juice, blended fruits, and dried fruits. High fructose corn syrup was less than 1% of caloric sweeteners in 1970, but it increased to 42% by 2000. They use it because it's cheaper, it has a better shelf life. It starts from corn syrup, and then it goes through a chemical process, and I think it's called I forget the name of it. It's like a wet whittling process where they actually convert more of it to fructose. The issue with this is that products will be labeled and they might say they have about 42 to 55% of fructose and the balance being glucose, but studies suggest that fructose is actually closer to 60%. So it's an unnatural amount of fructose that we're getting in that high fructose corn syrup and in those products that have high fructose corn syrup in them. Again, it's linked to obesity, fatty liver, and type 2 diabetes. Artificial sweeteners are linked to obesity, cancer, and cardiovascular disease. So sucralose, for example, can increase our triglycerides. Non-nutritive sweeteners like saccharin and sucralose can lead to dysbiosis, as well as stevia, which is listed as a nutrient sweetener or a nutritive sweetener. And they also can lead to increased caloric intake. So interestingly enough, the American Heart Association and the World Health Organization recommend that no more than 10% or about 12 teaspoons of sugar be added in our diet per day. The NHS in the UK, however, says about 5% or 6 teaspoons. Does anybody know what the current grams per day of consumption is, or how many teaspoons a day that we are currently getting in the US? You can put it in the chat if you'd like. There's well over 60 different names for sugar. Here is an example. Sorry, it's very small print, but this just gives you an example of some of the names. So dysbiosis is an alteration in the gut microbiome, which leads to fatty liver disease, insulin resistance, and obesity. And one study has shown that sugar alone has been associated with profound dysbiosis of gut microbiome, and alterations are similar to those observed in neurodegeneration, again, cognitive decline, dementia. So in summary, a whole food plant-based diet is really important, foundational. We want to avoid high and ultra-processed foods, refined carbohydrates, limit our saturated fat intake. We want to move. If your BMI is over 25, we know it's not a perfect measure. It's the best we have. Definitely work on weight loss. Get checked if you think or a family member is at risk. Improve your sleep, reduce stress. Make your connections in person, not online. And then here's one slide that I wanted to throw in here too, is oftentimes when people talk about lifestyle changes, they talk about, well, in 21 days, but that's a myth. The myth of the 21 days came in from a plastic surgeon who wrote a book in the 1960s, who said that 21 days was about the time it took for people to adjust to their new noses. So we know that it takes a lot longer than 21 days to sometimes make our habits stick. It can take several months. So it's the day-to-day consistency. In terms of taste buds, if you don't like, certain vegetables or fruits, your taste buds will turn over every 2 weeks. We typically have about 10,000, but as we age, that declines to about 5,000. So foods as we age taste less strong. So you may have a propensity for things that may be sweeter or stronger in some tastes just to satisfy those taste buds. But continue to work on it because your taste buds do adjust to the foods that you're eating. And again, supplements versus food, eat the food. Eat the turmeric root, not the turmeric in a capsule. And Dr. Greger on nutritionfacts.org has some really good information and data about this. And so for anybody who wants to know, the US recommends no more than 12 teaspoons of sugar a day. The UK is 6. Currently in the US, it's about 17 teaspoons. So of added sugar. It's a lot. So thank you very much. We'd be happy to take questions.
Yay, excellent. Well done. That was a great presentation. There's so much information there. I think we all have to sit and let that sink in. Thank you for that.
It's a big topic.
It's a big topic. And a couple things I just wanted to emphasize that you pointed out, but I'm just going to emphasize it. And that is, liver disease, fatty liver disease is considered irreversible. It's the number one reason for liver transplants in young people, and children and adolescents. And so the fact that people have to get a liver transplant when we're seeing results with diet and lifestyle, with a high fiber plant-based diet and active lifestyle is really just amazing to me. So the power of diet and lifestyle is this is one example where it's tremendous. It's tremendous, the results what it can achieve. So it's an important topic. It really is. A lot of people don't know. So if you don't even have to be very overweight, so a little extra weight, and sometimes we find it incidentally in imaging or in labs. And so, but the good news is, if anyone does have it or does find it or knows someone who has it, there is a lot we can do to potentially reverse it with diet and lifestyle. So as Keary so awesomely pointed out. I want to say hi to a few people. Hi, Penny from California. Hey, Fred from Minnesota. Nice to have you here. And hi, Ja. I don't know where you are, but hello. And then we have a couple questions that I wanted to put to everybody. Lori first says she's type 1.5 diabetic. I only eat 25 grams of fat per day from plants, but my insulin control is bad since gastroparesis worsened 2 months ago. Is that a mechanism of gastroparesis? How to reverse that? Any thoughts on fatty liver and gastroparesis?
So I don't know the link of fatty liver and gastroparesis just through the GLP-1s, through like medications like Ozempic, Wegovy, Mounjaro, things of that nature. I didn't come across anything specific, but having diabetes itself is a risk factor for gastroparesis. So that might be something you want to talk with your endocrinologist or your gastroenterologist about specifically, because there may be a lot of factors influencing that.
Yeah, absolutely. And I agree with you. I haven't come across anything directly about gastroparesis and fatty liver, but if you have fatty liver, there's a chance it's going to disrupt all of your digestion, right? So you're not putting out the digestive enzymes, and all the function of the liver is not going to be happening the way it's supposed to. And if there's inflammation locally, that can maybe potentially affect it. So I agree with you to work with someone to help you, and also work with someone with your diet and your lifestyle at the same time, so that you can see if you can improve all of that. But I have seen gastroparesis improve. So yeah, so you want to keep working on that. Let's see. Thoughts about genetically modified, or I think I jumped through. Sorry, I'm going to go back to, yeah, no, that's it. Okay. Oh, Kayla wants to know if we're able to receive the slides.
I think so. We'll have to figure out a way to do that afterwards, maybe.
Yeah, we can ask and see if we're able to do that.
So. Yeah, we'll ask about that.
But I know where you're coming from, Kayla. There's so much there. I was trying to pay attention to all of it too, and there's a lot of information. So those are super helpful slides. Fred has a question. Thoughts about genetically modified organs from pigs? I saw they just did that liver or that kidney transplant. I don't really have any thoughts. What do you think?
No, I thought that was interesting. I saw that, and they definitely made a note. He was at end-stage renal disease. So I wonder if he, agreed through, experimental to see how this will work, and maybe knowing that it may not work. So, yay for him for contributing to science. But it'd be interesting to see how it comes out. I don't know.
Mm-hmm. I know, that's interesting. So for anyone who didn't know, they did a genetically modified kidney transplant. So good question though, Fred. GE says, hi from Denver. Please list the top 3 things one should do to reverse their fatty liver disease outside of a plant-based diet using the foundation. Thank you.
So you want to decrease definitely your saturated fat intake, whether you're on a whole food plant-based or not. There are some plant foods that are a little bit higher in saturated fats. Typically across the spectrum, they're generally lower, but just really reduce saturated fats. You got to move. We've got to move, right? Exercise, even without weight loss, can help reduce the fat in the liver. And look at the medications, right? Look at the medications you're taking. Look at other areas of your lifestyle. Look at stress. If you have a really high stress lifestyle, you're going to increase cortisol, right? Which is going to increase your inflammation. It's going to increase sugar. It may increase your triglycerides, which is going to contribute to fatty liver disease. So they all interplay. There's not one thing that's going to be it. And there is no medication, right? There's no one medication, but there are medications that can contribute to the development of. So really work with your doctor and just peel apart that layers of the onion, everything that's going on in your life. And there, I see the question below, is there an annual test? So you want to look at your ALT and your AST, but they can be normal in advanced disease. So, your doctor should look at look across all of your risk factors, look at everything. And oftentimes it's found as an incidental finding. Somebody might be in the ER for something and they get a scan of their, like their chest or their abdomen, and an incidental finding of fatty liver is found.
Mm-hmm, mm-hmm. And I would add, to the question about the lifestyle factors, that remember, this is a holistic approach. We're holistic bodies. So if we're feeling really stressed, or we're not sleeping, or we're really lonely, all of that increases inflammation, and it also contributes to food choices we make or how active we are. So as we start to get our whole way of living under control, things fall into place a lot easier. And that's why a 6-pillar type approach to something can be very effective when we deal with the whole body, mind, body, spirit, every part of ours, not just the diet, not just the exercise, but we're looking at a much bigger picture. And that's where we see a lot more benefits in people having improvements. So hopefully that answered it for you. And then Hannah says, we're just going to go in a few minutes longer, if that's okay. Such good questions, and then we'll wrap it up. Hi, 2 questions. Can a high consumption of flaxseed oil contribute to fatty liver? If one cannot digest fats, would that also mean that one cannot absorb omega-3 oils?
I'll let you take that one, Dr. Miller.
So in general, the omega-3s do not contribute as much to fatty liver, right? She talked about saturated fat, and omega-3s are actually protective. So in general, I would say no. However, going to the second question, when you say if one cannot absorb omega-3s, is that going to cause a problem? I mean, if one cannot absorb fats, well, that will be a problem then, because you're consuming a high amount of fat, pretty concentrated if you're doing the oil, not the flax seeds. And so if you're not digesting the fats, digesting fats is a whole separate talk, but they're actually quite difficult. You have to eat it and you have to have enzymes kind of break it down, but then you have to secrete bile and you have to separate that bile acids, which separate it off and then reabsorb the fatty acids part of your food. And it's quite an ordeal, to be honest. So there's a lot of people may have hard time digesting fat. So working on your digestion, looking at your digestive enzymes, looking at your gallbladder function, all this type of stuff can be helpful for you. And hopefully you can improve your overall digestion of fats and then be able to eat omega-3s. And also you might do better eating the whole food. So eating like flax seeds, chia seeds, hemp seeds, that type of thing to increase your omega-3s if you're not absorbing and digesting that flaxseed oil as well. So those are my thoughts on that. All right, I think we got to the end. Holy cow, look at that. So I will say thank you to everyone for coming and joining us. And Dr. O'Connor, thank you for sharing this amazing talk with all of us.
Yes, and thank you for everyone for coming, for your great questions. Don't forget about our 6 Pillars program. Take a look at it, pass the link around to your friends. It's our chance to really take a deep dive into each one of the pillars so we can do that really a great foundation and help people build from there.
Hold on. Okay. I've worked on making that. So there it is. If you guys are interested, at least check it out, see what you think, give us some feedback. Hopefully we'll see some of you there. But yeah, our next webinar will be in 2 weeks. It'll be the first Thursday of April. So we'll have another great speaker, another great topic. So we hope to see you guys there. And thank you everyone for sharing your time with us today. We really appreciate it. And your questions and comments and participating with us. So thanks everyone. Take care. Bye.